if we talk about ecosystem and ecosystem leaders, you need also a different kind of mindset.
We're going to start our panel right now with Mr. George and Mr. Jean-Paul. It's a pleasure to have you here in Abu Dhabi. We'll start off with the most common talk nowadays, the AI. Mr. Jean-Paul, I would like to know, what is Sanofi looking to do right now in terms of AI when it comes to your upcoming projects?
So good afternoon to everyone. Well, obviously AI has multiple applications right now, right? I mean, from private to the professional environment. When we talk AI at Sanofi, I mean, I would say that we are taking it at three different levels. The first one is it's a tool that has been, and it's a way of working that has been developed internally, and we have developed a certain number of ways of working. I mean, the way we are leading teams, the way we are making decisions based on AI. We have a tool that we call Play, which has been developed internally, and that really is helping to decision making and managing our activities. And this is something which has really transformed our way of working, even if this is quite difficult in terms of change management and adapting to this new way of working. But this is something which has been put really from the top of the organization. The second is, and I think it's quite critical, especially following the COVID period, it is that the way we have been improving our manufacturing capacities. AI has been really helping us in better managing manufacturing and stocks. For example, we can now predict with a very high level of accuracy, almost at 80% actually, I mean, which stock level will be needed, and that will help definitely in avoiding the out of stock. And I think that during COVID period, I mean, we have seen how much ensuring the availability of product has been critical. And the last major field of application of AI is, of course, when it comes to clinical studies and real-world evidence. In clinical studies, this is definitely helping to reduce significantly the time needed to make feasibility studies and then to assess and then lead clinical studies. And obviously, this has an important impact on our capacity to bring innovation much earlier. And when it comes to real-world evidence, we have some work ongoing in the region, very importantly around AI, to better diagnose actually and to bring treatment earlier. This has been the case in, for example, in rare disease, where we have various partnerships in the region to better identify, to bring treatments earlier. And that's one of the major fields, I mean, which has a direct impact on the capacity we have to bring a treatment to patients.
Interesting. Thank you very much. Okay, I have a question for the both of you, actually. And how do you think the public and private partnerships kind of accelerated or improved the delivery of the treatments?
Thank you very much, first of all, also for the invitation to this Congress. It's really a pleasure and welcome to everyone. I would like to add also something to the artificial intelligence and also robotics, because you mentioned a lot. I think we all do the same. But there's also in research and development a fundamental shift. Yeah? Just as one example, whenever someone has the chance to visit our campus in Basel in Switzerland, you can see also there a robotic arm for research and development. It's very visible behind the window. And we have one of the biggest molecule databases, as well as also gene databases. And this robotic arm is not doing anything different than just mixing molecules and testing on which kind of genes it's working. And then artificial intelligence gives a hint to the research team where it might work for which kind of diseases. And I think this is also where we can see that research development in the pharmaceutical company, there is really a fundamental shift using artificial intelligence and robotics.
I guess that is contributing to medicine in general, like even for us in dentistry, we find a major change going on with AI. Actually, a lot of people are worried about the industry.
Absolutely. Yeah. But now coming to the one topic related to partnerships. Yeah. I think the world is getting so complex. I think it's not possible anymore as a pharmaceutical company or as any kind of key stakeholder in the healthcare ecosystem to deal with it on its own. I think it's really important that we step out of our silo responsibilities and start to develop a kind of I always call it ecosystem leadership, because you have to have a different kind of purpose, you have to have common goals, you have to really change also the prediction for our patients, and you can measure also better outcomes. And only if you work together holistically, you can really drive a difference. And I think we are talking about expanding access to innovation, but also accelerating research development. We are talking about strengthening healthcare systems, but also addressing the complex healthcare challenges in general. And just one example, together with Abu Dhabi, we call it population health. It's for cardiovascular diseases. We work together with the Department of Health to really develop data and digital. There's an integrated database of all the different kind of healthcare providers, and then you can really start to better understand what is the burden of disease. Okay. And if you understand the burden of disease, you can start to work on the complexity to really create a managed care program where you have early detection of responsibilities, then also management, comprehensive prevention programs, and then you can really manage cardiovascular disease completely different, which is one of the major causes of mortality and death.
Indeed. I would like to get your opinion on that as well.
I fully subscribe to this, and when it comes to healthcare, I think it's been a while we have realized that only one actor will not make it happen alone, so that we can really bring something to the community only if we are all putting our energies together. And I think that I've been working in quite a lot of different countries, but nowhere better than in this region we can really talk about efficiency of the public-private partnerships. The authorities here are very much open to really collaborate with all actors, with all the ecosystem, and in particular in healthcare, and that is really helping in implementing, really significant and impactful projects for the community. I will mention very few. I was mentioning rare disease just before. When it comes to this, to rare disease, we know that time to treatment, time to diagnosis is extremely critical. It can take basically, sometimes 3, 5, 7 years before we can bring a diagnosis to a kid, actually, and that's a matter of life saving, right? So cooperating on working on we were talking about AI, working on together on databases actually will help us to accelerate diagnosis, creating model using AI actually to bring a diagnosis and treatment more easily and much faster to patients. And this is something on which we have been working very well, especially with Department of Health in Abu Dhabi or in other countries, in Saudi in particular. Another example of what has been done, working on beyond, we've been having partnership around vaccine, particularly on flu vaccination, we've been having on diabetes, but the most recent example is what we've been doing around asthma. We know that the prevalence of asthma in the region is extremely important and significant, more than in a lot of other regions of the globe. And the education that we need to bring to patients, to parents, the education we need to bring to kids as well is very important in the ability that we have to control asthma, especially with the kids. So we have implemented a wide project of bringing education to kids at school. And this is something which has been kicked off in the UAE, but that we will kick off in Saudi, very soon. In Saudi, it's going to be a massive project involving more than 20,000 schools, more than 5 million kids are going to be taught on how to live with asthma or how to consider and help your friends actually who's asthmatic to live with this disease. And we are breaking barriers, we are breaking silos doing this. And again, this is really, thanks to the openness of the authorities to work with a private ecosystem as well, with the only objective really of bringing a better care to patients. And yeah, that's worth mentioning.
So indeed, this collaboration is in everyone's benefit. Okay. Mr. George, how is Novartis at the moment foster the diversity and inclusion on the ground?
Yes. I think first of all, as I said, if you talk about ecosystem and ecosystem leaders, you need also a different kind of mindset. Yeah. Previously in companies, we were talking about entrepreneurs, you need not silo thinking. Similar mindset we have to establish now in the healthcare system, and that means also you need a different kind of workforce who is able to carry on a purpose, who think broader than just within their own perspective and silo. And I think, first of all, it's also important, if we think about ecosystems, then you have to represent as well also the society you're working in. And this is one of the parts where we're working very closely to have a high number of emiratization, because it helps to represent also the society. And we have different kind of programs where we work on capabilities to really create also the workforce of the future who can really manage also the key requirements to manage the healthcare system and all the burdens and the topics we will face. Another point is also, we as an organization, we started to change also our internal processes and also some of the programs to really allow that also people with chronic conditions find a good place to work within Novartis. Because you have to imagine, we are existing out of thousands of people, and we are representing by ourselves all the different kind of diseases. So if you would like to make sure that patients feel well, we have to start inside out, that we also create workplaces where people feel comfortable. And just one example, which I think is really very nice, and which was a main changer also for me personally, where when I worked in Europe, in Italy, the MS society approached us. They have a couple of young students who studied business, but they have difficulties to find any workplace related to their conditions. So we felt responsible to hire someone of them for an internship. But at the end, we hired them not due to MS, we hired them due to the capability of being one of the best students from the business school. Mm-hmm. And she worked with us in the neuroscience department. You cannot imagine what it created in the organization. First of all, a complete mindset shift about what does it mean working with chronic condition and all the preconceptions which are existing. And the second one is the knowledge inside out, working with a patient on programs, on activities, which can really be a game changer, how you deliver also your solutions, not just medications, but really treatment solutions, also to the public. It really made a difference.
Great. Okay, general question. I would like to know, how do you measure the success or the impact of your treatments?
Well, if it comes just to treatments, obviously, I mean, you have various ways to assess the efficacy. I mean, the first way is prior to launch or post-launch clinical studies, which is one of the best ways that you have to really assess the efficacy and the safety of the treatment. I think the development of what we call real-world evidence is something which has been raising over the past years, and which is very important, because this is probably the best way post-launch that you can really assess the efficacy of your treatment. I mean, in a real life and real condition. We know clinical studies, they are very much framed, they are done with a very strict protocol, and that's obvious because, I mean, these are needed in particular for regulatory purpose, and they need to be very well and strictly monitored with a very strict protocol, as I was mentioning. But real-world evidence is really the possibility we have to monitor efficacy, safety, and the way the treatment is used in a real life, in a real condition, and that's definitely, I mean, one of the best ways we have today, and we have this capacity accessing data, and again, partnering with authorities and healthcare professionals to get to this. We have multiple, I mean, we have in Sanofi in the region more than 11 real-world evidence projects going actually in various fields, including in rare disease once again. So really we have this capacity through these kind of studies to understand better the impact that the treatment may have.
Great. Mr. George, would you like to add anything to that?
Yes, I fully agree also with Jean-Paul. I think just additional thoughts. One is also with all the real-world data we are generating, as well as also registries which are existing. I think at the end it's about outcome for patients. Mm-hmm. And this is also where we can see a general shift. Yeah? We are moving from selling products for a certain price to outcome-based agreements. And I think what is also important, because the topic is about patients, really making sure that patients are aware about their conditions, are aware about their numbers, and really become also managers of their own disease. And I think this is where, in the long run, we will measure together in the healthcare system, together also with the provider, with the payer, what is the best outcome for patients. And how can we really make sure that the society stays healthy.
Mm-hmm. Okay, so to wrap up, I would like to know, there's a very hot topic going on now, which is sustainability. How would you say that sustainability is included in your upcoming strategies?
You want to take it, George?
For
yes.
both of you. Yeah.
I think, first of all, for all the companies, I think it's a must, sustainability,
indeed,
because
yeah.
It's also part, if you're on the stock exchange, it's a must to reach also your certain KPIs, because this is also how your shares are evaluated. But I think it goes much deeper. I have a daughter, she is 19 years old. She is Generation Z. At the end, we have to create a planet for the future generation. I think this is also, I just had a recent conversation also with her, and we were talking about how she is choosing a future employer and what are the criteria. And sustainability is one of them, because she would like to make sure that there is an employer who takes full responsibility in making sure that the planet stays alive for the next millions of years. And I think this is how we should see it.
No, I mean, as George said, actually, I think all companies are really much involved and to reduce the impact of their activities on the environment. And I believe that almost all multinational, if not all, have, projects actually to reach carbon neutral activities within the next 5 to 10 years, 15 years, and there has been a lot of announcement. And I believe that this is part of the responsibility that we have as private entities, and to make sure that we are reducing our carbon footprint on the environment. Now, there is also a lot to be done, and the COP28 is going to happen just next door, right? It's going to happen in a couple of weeks here. And you know probably that during this very important conference on environment, there is also a specific day dedicated to health, actually, and where a lot of projects are going to be discussed this year, and in particular on how can we further accelerate the decarbonization of healthcare. Through very, very simple ways, right? I mean, we were, for example, at Sanofi measuring that just changing the way of method of administration of a product, for example, from a syringe where you need to go to the hospital to get the injection, to a pen actually that you will be able to self-administer at home. I mean, that seems nothing, but that has actually a significant impact on environment. And through these kind of small steps actually, and the industry is very much active in that respect, you can really have a very positive and significant impact. It also goes to, in countries which are very widespread, let's take Saudi actually, when a patient needs to fly to a major city living in a village, I don't know, in the south or north, and to get access to its treatment. I mean, that also has a carbon footprint. When you can organize that this patient will be taking this treatment or this infusion at home, I mean, that definitely also has a positive impact. So through all these kind of small projects, I believe that the industry is very much mobilized and very much aware about the need to work on this kind of topic, and sustainability is obviously one of the top priority in the strategies of companies. I mean, and I guess that's the case for both our companies and for all others.
Absolutely, and all the top management, including us, has it also in our targets to reach certain targets and limits.
I mean, it is great, actually, as you mentioned. It is entering our life bit by bit, whether it's at home or at work. At least we're very glad that the upcoming generation is also paying attention for that, starting with us as of today. Okay, thank you very much.
Thank you.
Thank you very much.
Thank you all. Thank you.
Thank you very much.
Thank you.